a good phaco training can be given even in private hospitals. The first topic today is on developing hand-eye coordination. It will be dealt by Dr. Nilufer Syed Mohammed. Dr. Nilufer is a consultant eye surgeon from Eye Vision Eye Hospitals, Thrissur. Over to Nilufer.
Good morning, everyone. My topic is developing hand-eye coordination in cataract surgery. As you all know that cataract surgery has a steep learning curve with high stakes for the patient. Yes, as I said, cataract surgery has a steep learning curve with high stakes for the patient. Hands-on experience is necessary to improve the surgical performance and prevent complications. Studies have proven that wet lab training shorten the learning curve and reduce adverse events in practice. Now, the wet lab training, it provides a risk-free environment where the surgical trainees become familiar with the handling of surgical instruments, microscope, develop good hand-eye coordination, and practice the surgical steps. Ideally, a wet lab should simulate an ophthalmic operating room. It should include a operating microscope, ophthalmic surgical instruments, refurbished or re-sterilized single-use instruments, animal or human cadaver eyes, and devices to mount them, phaco machine refurbished. Now, before the trainee starts the wet lab training, they have to attend lectures on the surgical anatomy of the eye, watch detailed videos of steps of surgery, also of its complication and management, attend live surgeries and observe the surgeon performing surgeries. In wet lab, they should familiarize themselves with the instruments, including the microscope and the foot pedal. Now, initially, we start off with suturing. It is a great way to develop hand-eye coordination. What we use is polyurethane foam sheets which come with the ophthalmic suture packaging, and the trainees are asked to place at least 20 sets of sutures each session, and we note the time and the placement and all. This is what we do. We place the polyurethane foam sheets, we fix it with rubber band on a betadine bottle, and we draw with the shape of cornea and perpendicular, so that perpendicular sutures can be placed. And the trainee, after placing the sutures, they have to come and show the mentor or trainer. We check for the equidistance and whether sutures are tight or loose, and also the time taken. Now, coming to practicing the steps of surgery, human cadaver eyes provide the best model for teaching ocular surgery, but it's difficult to get unless it's not suitable for transplantation. Meanwhile, goat eyes are easily available, and its anatomy and tissue texture closely resembles that of the human. What we do is we place the goat's eye, we mount it on we mount the globe on a forceps jar and take 2 bites with 3-0, and then secure it in place with rubber bands, and we inject normal saline to make it firm. Other commercial mounting devices are available: Mandel's mount and styrofoam wig head. The trainee can start practicing creating sklenocorneal tunnels on 4 sides of the globe. At least 20 tunnels should be made on goat's eye. You can practice capsulorhexis and hydrodissection to a certain extent, but there is limited scope for practicing nucleus prolapse and delivery. Here our trainee, she is practicing tunneling on goat's eye in our wet lab. Moving on to capsulorhexis, we can use thin polythene film that comes with the packaging of IOL. We mark circles of 6 to 7 millimeters, and the trainee uses a cystitome to practice rhexis within the mark under the microscope. At least 100 attempts of capsulorhexis should be done like this. Alternatively, you can use gift wrapping paper to practice rhexis. Here she is using polythene film that comes with the packaging of IOL. And this is the gift wrapping paper I mentioned. This is much better, I feel, because you need more control of it, and they have to place, they have to do the rhexis within the markings, and minimum 100 capsulorhexis should be done like this and shown to the trainer. Now, moving on to the phaco emulsification. Nucleus extracted through SICs is placed in the model eye, and by using phaco machine in the wet lab, surgeons learn the principles of phaco while practicing using the use of foot pedal. What we do is the SACS that we extract, the nucleus that we extract through SACS, we place it in the model eye, and then the trainee practices in the wet lab the various steps of phaco. Coming to synthetic and artificial eye models, these are commercial ones. Teaching of cataract surgery around the globe varies according to the resources, financial power, and demands of each location. Its cost is relatively high compared to the eyes of animals. Just mentioning a few, there is something by Simul Eye, that is Simulorexis, where you can practice the Capsulorexis, and then more popular ones are Bionica models, where you can practice several steps, and then the complete wet lab kit of Kitaro. It is a complete commercial kit in which instruments are also coming. Moving on to the modern training techniques in cataract surgery. As you all must have heard, virtual reality based simulation training is gaining popularity. It's part of the curriculum of ophthalmic residency programs in many Western countries. You can develop microsurgical motor skills and good hand-eye coordination. We can use instruments and get good tactile feedback also. You can practice nearly all the steps of cataract surgery, and studies have shown that it reduces the surgical time and complication rates. IC, this is the most popular VR simulator training program that's available, and it is almost standardized in Western countries, and it's part of the ophthalmic residency training programs in US. It's used in high income countries. You can practice all the steps of cataract surgery, and also VR surgeries can be trained using this. Its software is also capable of storing residents' performance metrics, allowing a score to be generated as well as a feedback. We can watch a video.
IC Surgical is a high-end virtual reality simulator for intraocular surgery training. Original instrument handpieces are inserted into the simulator's model eye. Looking through an OR microscope, trainees experience their interaction with tissue and intraocular structures simulated in real time. The pre-installed IC courseware offers training at different levels of difficulty, from basic skills training through to surgical procedures and complications management. For cataract surgery training, instruments such as forceps, viscocannula, cystotome, and phacoprobe are available. The simulator provides an OR machine interface and instrument foot pedal to control fluidics.
Moving on to the next VR simulating machine. You all must have heard about Help Me See. It is available in India. They have training programs in SICS and phacoemulsification. This is also VR based, and you need a trainer to train you in this. It is slightly different from the IC. Moving on to live surgical training. Initially, the trainee has to undergo an observation period where they closely observe the senior surgeons operating on patients and maintain aseptic precautions. Patient selection is important for the trainees. You need to choose uncomplicated cases. The microscope should have an observer scope and or camera and monitor for viewing. Initially, you start with step surgeries and progress to the next step only after performing the previous steps satisfactorily. Patient safety is very important. So if there is any difficulty, it's immediately taken over by the trainer. We have to, as the surgery is recorded, you can discuss later on with the mentor and trainer. You have to maintain a logbook. And also there is a scoring, the objective scoring of the surgery, which can be adopted. It is using the ICO Oscar. It is available in American Eye Academy website and ICO website. Here the steps of the surgeries are divided into 13 steps and then scored according to novice, beginner, advanced beginner and competent surgeon. So this is very good in evaluating and assessing the progression of the trainee. Post-op complications should be discussed with your trainer, and follow-up of all the cases should be done. Thank you.
Thank you, Nilufer. That was a very useful talk with good visuals. She has highlighted a very important step in the training. We normally look at our hands whenever we do a fine activity, but in microsurgery, you have to look through the microscope and not on our hands. This needs some training and practice, and above all those videos, what all things we are doing in our hospital, Dr. Nilufer had shown. So all these things will help the trainee to get their hand-eye coordination. Thank you, Nil.